Dr. Thad Dean with AOA Orthopedic Specialists here in Mansfield and Midlothian. We'll talk today a little bit about joint replacement surgery for the knee, specifically partial and total knee replacement. These are excellent operations for folks with knee and arthritis pain, a pain that has progressed over time and created debilitating pain and change in lifestyle secondary to this. This happens from the wearing of cartilage over time and creates a position where the bone of the shin bone and the thigh bone are rubbing together. We have an opportunity then to replace what used to be cartilage with a metal and plastic bearing surface that's seen in these models. This represents a total knee replacement where the entire knee has been resurfaced. You can see that there's a metal articulating surface with a plastic articulating surface, and this recreates what would have been your normal joint anatomy. In situations where only a part of the joint is involved, we can offer a partial knee replacement, in which case we use only the portion of the knee that has been lacking cartilage and creating the arthritis to be replaced. This shows the inner compartment of the knee or even the kneecap or the patellofemoral compartment. These are excellent operations to help with debilitating knee pain and can help you with your day-to-day life.